Hi, everyone. My name's Tatum. I'm the founder of Underdose, the world's first all-in-one fentanyl test designed for users, not scientists. So for those who don't know, fentanyl is a synthetic opioid 50 times stronger than heroin, 100 times stronger than morphine, with just a few grains being enough to kill the average adult. Now, why is this an issue? Well, back in 2019, during my first 3 weeks of university, fentanyl took the lives of 3 of my classmates. And unfortunately, this wasn't an isolated tragedy. Fentanyl poisonings are now the leading cause of death for Americans 18 to 45. This is because it is often unknowingly mixed with other substances and is practically impossible to detect without the use of a test strip. Now, using a test strip sounds easy. However, it only represents one part of the testing process. Users are then left to conduct a dangerous makeshift science experiment with their very lives on the line. Simply put, the current solutions on the market are unreliable and unrealistic. Multi-step processes increase risk of user error and contamination, and their lack of portability and discretion make them impractical for users. Thus, it was time for a change. Introducing the Underdose card, a compact, discreet, easy-to-use test that can detect fentanyl in less than 90 seconds, no additional tools required. Our patent-pending all-in-one design features a removable scoop for precise measurement, a water reservoir for accurate dilution, and an included fentanyl test strip, eliminating all of the guesswork. Okay, we're taking this off. We talked to our customers. Over 95% of people want to identify the presence of fentanyl and believe that these tests can reduce the risk of overdose, yet only 47% of people have used a test strip before due to its inconvenience. Now, considering there are nearly 300 million drug users worldwide, a $6.3 billion global testing market combined with billions in government funding, recent legalization, and California's college campus fentanyl testing mandate, we're projecting a sum of around 70 million, given capturing around 5% of this market. Our cost of goods range from $2.50 to $1.70 at scale, selling them for $8, leaving us with a 75% gross profit margin. We expect to be profitable by year 2, project over 21 million in revenue by year 5. Incredible team of advisors ranging from healthcare advisors, product designers, IP lawyers, etc. Remember, testing for fentanyl doesn't have to be difficult. In fact, the answer may just be right in your pocket. Thank you.
Where are you in the development? I just saw the actual kit, so where are you in it? And I don't recall, but maybe it's late for my brain, and ask, are you raising? And if so, how much and for what?
Yeah, so right now I have a product roadmap as well in here and some traction. Might be too far in, but essentially right now we're working on finalizing our working prototypes. We're looking to prioritize this summer for product development, open up pre-sales in the fall, and ideally launch full scale early 2025. We are considering opening a round of raising around in about a month, like an angel round. We haven't dug everything out yet, but we're gonna say around 300,000 just to support, again, the product development and then the initial upfront costs of manufacturing, the tooling, and then as well as some IP stuff and costs for patents, et cetera. And I'm happy to expand upon go-to-market, FDA, anything you'd like.
Just making sure I understand kind of how you use this.
Yep.
The card itself, what do you need to do with it?
Yeah, so I know I'm kind of far away, so I can show you in person as well, but essentially all you would do is scoop a sample of any recreational drug, usually in a powder form. You'd place it into the card, which would puncture the water reservoir. The water would then touch the lateral flow immunoassay, and you'll get your results in about 60 seconds. You throw the whole thing away.
So this isn't a test so that you know that you actually got poisoned. This is not a post.
No, this is preventative. Exactly. Right. So
okay.
this is testing. This is not like Narcan. This isn't the after, damage control. This is to see if the drug you are about to take is contaminated with fentanyl.
Got it.
Yes.
Okay. Thank you. How much does it cost?
Our cost of goods range from $2.50 to $1.70. We're hoping to get that down. Selling them retail for around $8. Again, want to get that down. And then for the public benefit angle too, it's about a 20% margin. And then retail, we'll be selling wholesale for $4. But again, the goal, the ethos of the company is we want it to be accessible while still maintaining healthy margins, right?
And who are the initial target markets that you're going after? Are there students? What are they?
Yeah, great question. So here's what it is. So obviously, built for users, for our direct-to-consumers, college students is a huge segment, as well as recreational drug users, young adults, and even families of adolescents and young adults is a huge market. So for example, because California now has a mandate that fentanyl test strips must be on all community and state college campuses, educational institutions have become a huge B2B partner as well, along with NGOs, healthcare providers, government agencies, large-scale retailers, the list goes on. So in terms of early adopters, students have been number one. We've also experienced tremendous traction. I mean, I drew this on my iPad 3 months ago, and we have over 400 people on a wait list, 10 pending partnerships with including the National Substance Abuse and Mental Health Services Administration. It's just kind of blown up, and the pull and demand is really there. So right now, it's all about speed to market and to get this out there as soon as humanly possible.
Where are you? You mentioned FDA. Can you talk about that, and where are you on that?
Yeah, so that's my favorite part, is that it is unregulated. So technically, I don't need to go through any FDA approval, which is wonderful when you're talking about speed to market, right? However, ultimately, the company and myself we have a bottom line, and it needs to be tested independently and efficacy and all that. But from a technical standpoint, there are no regulatory hurdles.
How much error do you have in the testing? Like how much do you need to test it to know that it's accurate, etc.?
Can you clarify? Are you talking about the accuracy of the test, or
of the
how much
test
substance?
itself, identifying substance in the actual testing? So what's my risk of doing it and getting the wrong answer?
Sure. So again, it's using existing technology, which is the lateral flow immunoassay strips, which are over 98% accurate. Okay. Yeah, and then of course it's harm reduction, right? Nothing's ever going to be 100%, but it's just reducing that risk by a drastic percentage.
I guess from that standpoint, just curious, what how protectable is this, and what would you be able to do to manage that as you?
Absolutely, IP strategy has been top of mind. So it's I currently have filed a provisional patent. So the novelty is in the utility; it's a utility design. However, we're also working on some specific features like the included water element. That's a proprietary aspect of the design. So for example, if we were to get that patent and there were to be competitors, if they can't use an included water element, that's an additional step for a user, which is decreasing its value, right, in the eyes of the customer. And from a direct-to-consumer standpoint, the value is that it's convenient. From a B2B standpoint, I can argue that it's a more accurate test, right? You're reducing that risk of user error. And ultimately, that 98% accuracy rate, it's not even close when people are doing this, especially in nightlife environments. Who's doing science experiments in a club? No one.
And just to follow up on that, from a manufacturing standpoint, then you'd be buying the test strips from a third party. So the primary validation is quality controls in the test strips, and then you're just assembling these pieces.
Correct.
Tatum, is the card looks like an elegant solution from here. I can't tell exactly, but is the water portion that's refillable, and so the card is multi-use, or it's a one-time use?
Great question.
Device?
So this is one-time use.
Right.
However, we've gotten a lot of feedback from people who want a reusable version. So that's absolutely already in the pipeline for future product line expansions and other products for different use cases. This was like bottom line MVP. This is V1 prototype. It's what's the cheapest we can make this, and one-time use, right? Because it's that included water element. Once it's used, it's contaminated. So the idea is you have it, test it, throw it out. Don't have to think about it. Trying to think if there's anything else relevant that might be useful, but I can share a little bit about the traction. I've also had the pleasure of participating in a few other pitch competitions, maybe not at this hour in the day, so I probably did a bit better at those. But the responses from the community has been the most rewarding part. It's a very mission-driven company, and the community is there, and the pull is there. People want this yesterday. So I'm here, would love to talk with people who are interested, would love to build out my advisory board, and take those steps to execute right now.
Yeah, just on that, curious, you sounds like you've spent a lot of time with students and colleges where this is a big challenge. Education and awareness there might be relatively easy. What does that look like, sort of, I guess, outside of the academic environment? I'll say, on the streets, so to speak.
Yeah, that's a great question. I think we're targeting Gen Z, right? And the educational barrier isn't what it is for other generations. Most people are aware of this epidemic and are aware, and a lot of people in this community are already testing their substances. It's a lack of accessibility and lack of convenience that's stopping them. But we've found that, at least within our target demographic, there haven't been any significant educational barriers. However, that's also a part of our mission to establish ourselves as a place where you can get reliable information and, receive trustworthy products, ensuring your safety, so on, et cetera. Oh, yes, please.
This is huge. How many lives do you forecast you'll save per year?
Oh gosh, well, I have to say, I want to say the updated number is about 150,000 people died last year in America from this. So I don't know, let's say 50,000 people, I would hope. If it's one, it's enough, honestly. And I know I'm over time, but the comments and direct messages I've received from people, one of those would be enough to commit doing this for like the rest of my life. So if you guys are interested in it, please come talk to me. I would love to make this happen. Thank you.
Awesome. Thank you so much.